we are covering specimen logistics for the phlebotomy exam, focusing on two key transport methods: pneumatic tube systems and couriers. The exam will test your knowledge on which specimens can go in a pneumatic tube and how to maintain specimen integrity regardless of the transport method. Pneumatic tube systems are fantastic for rapidly sending most routine blood and urine samples across a hospital. However, the exam will give you a list of samples and ask which one cannot be sent via the tube. The two most critical exceptions to remember are platelet function tests and, in many cases, arterial blood gases, or ABGs. The rapid acceleration and deceleration of the tube system can cause agitation, which activates platelets and ruins a platelet function assay. This same agitation can cause hemolysis, falsely increasing potassium, LDH, and AST levels. For ABGs, the issue is often a combination of potential agitation and the delay in getting the specimen onto an ice slurry, which is critical for accurate gas level measurement. Some hospitals do allow ABGs in their tubes, but for exam purposes, consider it a high-risk option. The exam loves to trap you here. They might list a routine CBC, a serum potassium, a platelet function analysis, and a urine culture. The correct answer for what not to send would be the platelet function analysis. When specimens need to go to an off-site reference lab, a courier is used. This is where specimen integrity during transport becomes paramount. The exam will test you on three components: temperature, time, and agitation. For temperature, you must know which specimens need to be ambient, refrigerated, or frozen. A test for ammonia or lactic acid must be transported on an ice slurry. Conversely, a cold agglutinin test requires the specimen to be kept at body temperature, 37 degrees Celsius. Frozen specimens must be shipped with dry ice in an appropriate insulated container. A common exam question will present a scenario where a sample for a frozen test is shipped with regular ice packs. This is incorrect and would be the right answer to identify the error. Time is another critical factor. Tests like coagulation studies, such as a PT or APTT, are time-sensitive and must be processed within a specific window. Finally, to prevent agitation and breakage during courier transport, all specimens must be placed in a biohazard bag and secured in an upright position within a rigid, insulated carrier. To remember the key pneumatic tube exceptions, use this phrase: "Don't shake the plates or send gas through the tube." This will help you recall that platelet function tests, which are ruined by shaking, and arterial blood gases should not be sent via the pneumatic tube system. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.